Good afternoon, everyone, and thanks for joining us. Again, we have Dr. Shahab in the radio room in Regina with us today. We do not have any officials joining us over the phone today. Dr. Shahab will have a brief opening statement based on today's case update, and then we'll have about 20 minutes for questions. Dr. Shahab?
Hi, thank you very much, Jim. So I'll start with some updates on numbers over the weekend and where we are today, and then happy to take your questions. So as of April 20th, we have one new case reported from yesterday, bringing a total to 316 reported cases. All cases are confirmed. 74 of the 316 are considered active. 4 more people have recovered, bringing the total number of recoveries to 238. There are 4 people in hospital, including 3 who are receiving inpatient care and 1 person in ICU. Of note, of the 316 cases in the province, 134 are travel-related, so less than half. 132 are contacts of travel-related cases, usually close household contacts or linked to mass gatherings that happened in the past. 30 have no known exposures and therefore are considered local or community-acquired transmission, and 20 are under investigation. And in terms of breakup by jurisdiction, 149 from the Saskatoon area, 70 from Regina, 60 from the north, 15 from the south, 11 from the central region, and 11 from the far north. In terms of age ranges, we have 24 under 19, 114 20 to 39, 106 40 to 59, 63 in the 60 to 79 age group, and 9 in the 80 plus. 52% are males, 48 females. And to date, we are at 4 deaths. And 24,402 COVID-19 tests have been performed, so our testing numbers continue to be high. In terms of the numbers, it's really important to recognize that through all of our efforts, our curve remains flat, and our reproductive rate, or RT, has been below 1 for 2 weeks and more. So that really means that we are managing to keep the curve flat and actually bend it downward. So that's very reassuring. But again, while that is very reassuring, it still means that we have to continue doing everything we've been doing. And especially, it's been more than a month since we've been practicing physical distancing very diligently, staying at home unless necessary to go out, shopping and doing other things outdoors, other essential work in a very considered way. But as obviously the weather improves, we all should go out and enjoy the warm weather and take the full advantage of the spring weather and the coming summer. But it's important to just remember that as we are out and about, to just maintain some of those key measures that have served us so well. So that means, maintaining a distance of at least 2 meters while out and about, and many of us do meet, friends, neighbors when we're out. So certainly greet, have a chat, but maintain that 2+ meter distance, and no harm standing even 3 or 4 meters away. You can move away from the track and have a conversation, but keep that good distance among yourselves. If you have children with you, obviously, avoid children mixing and starting a lot of games where they may be handing things back and forth. That's still really very important, keeping children away from group settings. Being very cautious about shared surfaces. If there's a crosswalk which you have to press, otherwise it won't turn green allowing you to cross. You can use your elbow to press it. It doesn't have to be your hand, for example. So doing those kind of funny things that we're doing to avoid opening doors with our hands, if you can open it with an elbow, those kind of things. And then, of course, in many cities, the playground structures are still taped off, so please respect that. We're still learning about how long the virus survives in sunlight and the warm weather, but till such time that we have better information, and till such time there's procedures in place to clean multi-touch surfaces in the outdoor environment. We do that very frequently in grocery stores and other multi-touch services indoors. But till such time that there's better information about outdoor play structures while we're out and about, please do keep your children off structures that have been taped off. And so, with that, I think, we can continue to enjoy the excellent weather we're going to have tomorrow and over the coming days and weeks, while still maintaining physical distance and other measures to minimize transmission and keep our curve as flat and as low as it has been over the last 2 weeks. Thank you very much.
Thank you, Doctor. We now have about 20 minutes for questions. We'll take our first question from the phone line. Operator.
We have Alicia Bridges with CBC.
Hi, we're hearing from a grocery store union that some of their members say physical distancing rules aren't being followed and that there are too many people in the store. So I'm wondering if further enforcement on shoppers has been ruled out by the province at this point or discussed.
So I think the question was that physical distancing may not be observed in all cases. So yeah, I think that's a really important point that we all have a role in this. So obviously, from what I've heard, grocery stores and business owners have been doing a lot of work to try as well as they can to maintain physical distancing, set up, kind of tapes on the floor, or other signals that you have to stand 2 meters apart. In some cases, the aisles are one way. In some cases, only one person is allowed to go in, not a whole group from a family. And I think we all need to, as customers, respect that and also do our part, that when we're in, we also avoid that distancing. And if someone is picking something from an aisle, we can stand back while that person is done and then go and pick something and not avoid that crowding. And obviously, respect instructions that we're given about waiting outside for a bit. And ideally going one person per household with a prepared list so that you go in, you're efficient in terms of what you need, and then come out.
You have a follow-up, Alicia?
I do. Thank you. I'm looking for an update on what's happening in the La Loche area. Can you explain or provide an update on that, and also explain whether or not you're expecting more cases from that area?
So there will be a more detailed briefing tomorrow by the Saskatchewan Health Authority on all the steps that are being taken. So I will defer some of the details to that briefing. But obviously, whenever we have an investigation, which in this case involves an assisted living setting or an integrated health facility with one care provider and one resident, the other staff are put under ongoing surveillance to make sure that if there's anyone symptomatic, they are screened, tested, if positive or negative. So, but I'll defer to tomorrow's technical briefing by the SHA and all the steps they're taking for long-term care and other health facilities.
We'll take our next question from the room. Steph?
Yeah. How long before we can start to see restrictions possibly lift? Like, what's the time frame people can expect?
So in terms of when we can see restrictions lifted, I think there's kind of two ways of looking at it. One is, of course, that what we are doing today will have to continue even if there's other activities or opportunities that become permissible. So what that means is that, right now, physical distancing is important when we're out and about. Physical distancing is essential when we are, for example, doing grocery shopping. That will have to continue. But having said that, since we've all been so successful and diligent in doing that, I'm sure there'll be some look at what other activities can be allowed that lets us enjoy summer, lets us participate in other economic activity, but still maintaining that physical distancing. I think we should be under no. We should understand that till such time that there is an effective vaccine or treatment, or till such time that most of us have some level of immunity, we will have to maintain physical distancing.
You have a follow-up, Steph?
Yeah. What activities, economic or otherwise, are you looking at starting to lift restrictions on? Like, what are you focusing on to begin with?
So I would defer to the Premier to announce whatever measures, in the coming weeks. But I think it is important to recognize, like I said earlier, that obviously, we are allowed to take solitary walks. We are allowed to go out and enjoy the outdoors. And so that's something that, I would, in fact, encourage in terms of being outdoors, even if you have, taking advantage of the ability to do a lot of stuff which can be done safely, while maintaining that physical distance. And as we have learned from the retail environment as it relates to essential retail, gas stations or grocery stores, we've all observed how we all behave very differently now. Even when you go to a gas station, we're very conscious of not touching the gas valve and touching eyes, nose, or mouth, using a hand sanitizer if it's available, using a tap function to pay. So I think as other activities become allowable or permissible, we still have to maintain those good habits. That would be essential. And if we don't observe that, unfortunately, we will start seeing transmission because we have kept the curve extremely low. It certainly hasn't gone away completely in Saskatchewan and will not for the next few weeks or months. It has not gone away throughout Canada and won't for the next weeks or months. And internationally also, it's, different parts of the world are seeing different levels of the transmission. So we still have to maintain all those good habits for the foreseeable future.
We'll take our next question from the phone line, operator.
We have Mark Smith with CTV.
Hi, Dr. Shahab. The testing numbers over the past week or so have kind of fluctuated up and down. Is there any reason behind that? Is it demand? Is there a reason why they've kind of gone up and down so much?
So we have been, along with our SHA partners, looking at those testing numbers very closely, both at a provincial level and also at a sub-provincial level. And there's a testing strategy that is going to focus on 3 or 4 things. One is, of course, the general recommendation seems to be that you should test at around 1,000 per million rate, or several authorities have given that kind of rough number, and we obviously are well above that rate. And again, this is not a rate carved in stone. This is some recommendation that as long as you're testing enough and contact tracing everyone who's positive and practicing physical distancing, as long as you're doing these 3 pillars of public health measures, you can keep the curve flat. So we already discussed that we're doing physical distancing. We have capacity to contact trace every single person, and our testing numbers are high. But having said that, like we discussed last week also, there's a couple of reasons why we think the testing numbers may have gone down. One is, of course, that, even if we look at our test positivity rate, so 23,000 plus tests and 316 positive cases, it's well below 2% a test positive rate. So what that means is that even when people had traveled or had been to an event or mass gathering or had been a close household contact or otherwise had a fever, cough, aches and pains, even then 98.5% of the time the test was COVID negative because it was likely some other respiratory illness, coughs, colds, influenza that is going around. As those respiratory illness wane as we enter spring and summer, there'll be less symptoms requiring people to seek testing in the first place. Having said that, I think it's very reassuring to note that our test positive rate, even with lower number of cases, is not going up. So that is really reassuring. But I would again like to emphasize that as we get into summer, I think we should not become complacent as individuals. If we get a fever, cough, aches and pains, we must self-isolate ourselves right away, call Healthline and follow instructions, which may include testing. We must do our part because testing helps you to isolate for the right period of time, keeps your close household contacts and others safe because then they are given instructions about how to isolate or further instructions to monitor their symptoms. And it also helps us to inform where we are in this pandemic. Thank you.
Do you have a follow-up, Mark?
No, that's it.
We'll take our next question from the line, operator.
We have Lisa Schick with CJME.
Hi, I'm wondering, Dr. Shahab, you said that we're going to have to continue distancing until there's a vaccine or there's enough immunity in the population. But if we're only using a test which looks for people who are currently sick with the virus and we're only testing people who come forward because they're very sick, how will we know when there is enough of an immunity in the population?
Yeah, so the first part is actually the reason we need to do physical distancing is exactly because we can't pretend that it's only the cases who test positive are all the cases that we have. Most experts thought that when we had travel-related cases, that in some cases the cases may be so mild that we were lucky to catch 70% of travel-related cases. And that's why there's a federal quarantine order and a provincial public health order that if you have come from other parts of the world, you must stay home for 2 weeks. You can only take solitary walks, otherwise you must stay home at 2 weeks. And the reason we said that was exactly because we can't rely just on symptoms to tell when someone is infectious. 30% of people may have very mild symptoms or may even be asymptomatic in 10% of cases. So that's why staying home if you've traveled is essential. Isolating if you're obviously ill is important. Isolating if you're in close contact is important. And practicing physical distancing at all times continues to be important.
Do you have a follow-up, Lisa?
Yes. We've had several days now of only a few cases. You said earlier in your remarks that we've been able to flatten the curve and it's even going down a bit. So does that mean that we've reached the peak in Saskatchewan, or are we kind of on the other side of this?
So, we, I think, in some ways are, we can obviously congratulate all of us in terms of keeping the curve flat, because the curve is as good as what all of us do. And so I think that's one answer. The second answer is that I think we do have to remember that, we are trying our very best to prevent clusters or outbreaks in all settings, so hence the prohibition against mass gatherings, but obviously in settings where we have people who are more vulnerable, and that's long-term care, assisted living facilities, personal care homes. And so again, we've had a few instances where a staff member was positive. I think those facilities have worked very hard to contain transmission in those settings, and we need to recognize their efforts. And there's further guidelines now that the SHA will be speaking out tomorrow. So that's the other setting. And then, of course, in our essential workplaces, again, there have been instances of a case or a cluster. But again, those essential workplaces, management, employees, staff, unions, they've worked very hard together to limit further transmission as much as possible while keeping essential work happening, whether it's energy, power, water plants, policing, all those sectors in addition to health that are essential social services. Work goes on, but it goes on in a way that you minimize any case in the first place, but if there's a case in the work setting, you minimize further transmission. So I think all those steps are and remain important.
We'll take our next question from the room. Steph?
Yeah, Dr. Shahab, as you talk to the Premier's office and others about, what restrictions you might relax or what businesses you might allow to reopen, are you considering introducing any new restrictions in place, say around travel or people having to wear masks, in anticipation of some of these lifting and people, being in closer proximity as they are to each other right now?
So I won't go into the specifics because that's for the government to announce, but we've been looking at very closely, obviously, at our neighboring jurisdictions in Canada, at the US. We've been looking at very carefully at countries in Europe who are relaxing some measures. We've been looking very closely in countries in Southeast Asia that, in fact, tried to go back to normal and then saw a bit of a spike. And so what we have to do is that as we move forward on this, while maintaining physical distancing, while relaxing some measures, we need to continue to monitor very closely where is transmission happening. So while we went into these restrictions very quickly over a week, into fairly strict restrictions in the middle of March, as we move back, we will need to monitor where transmission is happening, keep learning about that, and that's where we may need to adjust how some of the restrictions are working on, or relaxations are working or not working. So we'll have to monitor that very closely, both in our own jurisdiction and also obviously learn from the examples of others who are going before us because they entered the peak earlier, especially in Southeast Asia, but parts of Europe as well, in terms of how they are managing after relaxing restrictions. What are some of the resurgences that they may see and the reasons for that?
You have a follow-up, Steph?
Over the weekend, I believe we found out some of the cases in northern Saskatchewan were tied to someone returning from northern Alberta working at an oil sands facility. Any update on how many cases are related to that?
So that is an ongoing investigation, and certainly northern Saskatchewan Medical Health Officers are working very closely with communities, with local leadership, and with their partners in northern Alberta to, first of all, obviously let individuals participate in essential industries as much as possible, but then a special caution that as people come back, if they were exposed to in a setting to a case or otherwise were in a setting or a facility where there were cases, there's some additional precautions that may include self-isolating for 2 weeks or monitoring your health very closely for 2 weeks and those kind of measures. So, it's a complex investigation. It's across jurisdictions. And the Northern Medical Health also working very closely both with the counterparts across the border in Alberta and also with local leadership and communities.
We'll take our next question from the phone line.
Karen Briere with the Western Producer.
Hi, I am wondering about false negative tests. I'm wondering if people have all the symptoms and are tested, but if the test comes back negative, they might be sent home and told to self-isolate anyway. Are you tracking those at all?
So we continue to work very closely with the partners in the Royal Romanov Provincial Lab, with our clinical partners, and also look very closely at research that is being published in real time. So the current test that is available is a PCR test. So if it's a positive, it's very, it's extremely likely to be a true positive. So that's the good piece, that it works if disease is present and the test is positive. That's really good. It's a really good test in that. So you can confidently say, test is positive, you have COVID, stay home till you're cleared, which is usually 2 weeks. If the test is negative, we need to approach that with the context in which testing was done. So, for example, someone has traveled or someone was a household contact of a case and that person has a cough. That person has a high likelihood of being COVID positive. But we also know that if you test early on in symptoms, your test may be false negative. So if you are a household contact, you just have a dry cough and you call Healthline, they may say, wait 48 hours. And once you develop, if nothing happens, you may just remain in isolation. But if you develop a fever, the more symptoms you have, the more likely the test will be a true positive. But you're absolutely right, and that's why our recommendation is that even if you have symptoms that are mild and as per Healthline are not enough reason to seek testing, stay home, isolate till your symptoms are gone for 48 hours. So if you just have a dry cough or runny nose and maybe allergies and maybe COVID, stay home. If you think it's seasonal allergies, still as an added precaution, stay home till your allergies settle. You may take your routine remedies for that. And then if everything seems fine, that's fine. Otherwise, if you still have symptoms that look a bit different from your seasonal allergies, absolutely call Healthline again and mention that, this doesn't look like my seasonal allergy in spring. And then that may be a prompt to seek further testing. But I think the context is very important. But obviously in this, we always say stay home if you have a cough and cold. But right now that's especially important.
Do you have a follow-up, Karen?
Yes. Do we know, have we been getting false negatives that do turn out to be positive?
There has been some work that's been done in settings such as essential workers, especially in healthcare, where they will repeat the test, where a decision has to be made that can someone continue to go back to work or continue to stay at home. So we have, in those settings, we have observed that initial test can be negative, but then as an added precaution, you wait a couple of days and then retest. But for members of the public, retesting is not recommended. If your symptoms are significant, you are tested. If they're not significant, the best advice is stay home till you've been completely asymptomatic for 48 hours. Because if it's another viral infection, that's fine. And if it was COVID where symptoms are so mild, and you wait 48 hours till all symptoms are cleared, then that reduces your infectiousness, even if it was COVID, and you either never got tested or your test was negative. And that's a really excellent point, that even if the test is negative, you must still isolate till 48 hours of no symptoms.
We'll take our last question from the phone lines, operator.
We have Allison Sandstrom with PA Now.
Hi, thanks for taking my question. I know that we're going to have to wait for tomorrow for updates about La Loche, but I was just wondering if you could speak generally about, in La Loche, they've implemented a curfew, and if you could comment on if curfews are effective in trying to contain an outbreak.
I would still defer to, and I'll request tomorrow that when the SHA is doing the technical briefing, I'll request them to have someone from Northern Saskatchewan, a medical health officer, to speak to this in more detail. But in general, I would say that obviously remote isolated communities are especially conscious of preventing as much as they can importation into their settings. And obviously, they also feel that if they have cases, they may have some specific challenges in terms of managing that. However, we have seen that the SHA has really worked very closely with northern communities to ensure that testing is available as much as possible in the north, and our testing numbers in the north are going up. Access to high levels of care is available if required. We have seen that in many remote communities, when there was a case, it has, just like everywhere else in Saskatchewan, people have successfully self-isolated at home and recovered within 2 weeks. So there's lots of positive signs that anywhere in Saskatchewan, for the vast majority, isolating at home, away from other household members, leads to full recovery in 2 weeks. But obviously, there are specific considerations and concerns in the north that the SHA and other partners are working very closely with them to support whatever additional measures community leaders may think are necessary.
You have a follow-up, Allison?
No, that's it. Thank you.
Great. Thanks very much for joining us today, everybody. That's all the time we have for today.